welcome to Hormonify 104. This topic is by request from so many of our patients, and it is entitled, "The Fear of Losing My Mind." Unfortunately, many doctors, when they see a patient who's having some cognitive ability reduction, which means the ability to think clearly, right away ask the patient, "Is there Alzheimer's in your family?" And right away, patients go, "Oh man, yes, there is." Therefore, the fear of losing their mind and having Alzheimer's or senile dementia, even though they're only 52 years old, creates a lot of fear in everyone. And it should, because that's a horrible way to live your life where you can't remember. However, short of the rare cases in people 50 or 60 years old, it is not due to senile dementia or Alzheimer's. My experience has been that so many of my patients who are professionals complain of foggy thinking. They just can't seem to grasp the details they used to grasp. They forget little things. And there are two things that go on that's very important to understand when you go through hormone deficiency, especially progesterone and testosterone. And that is that you don't sleep as well. Lack of sleep over a period of time will make you have cognitive problems. It'll make you not think clearly. You become foggy. The second aspect is progesterone has a direct effect on brain function. So women who are pregnant know that they're pretty sharp. And that is a protective mechanism from way back when we're still evolving into who we are today. And that is that women who are pregnant have to be sharp. Their hearing goes up. They have to hear the crack of the twig from a big cat that may be 100 yards away. So the protective mechanism of increasing that acuity, the thought process, the way of seeing things clearly, the way of hearing things clearly, is inherent in the survival of our ancestors. So when I see patients who have been fine, they don't have any exhibits of any kind of short-term memory loss, but just can't recall the things that they usually recall as quick. They kind of say the words clearly. I have foggy thinking. A good example was I had a federal judge who was a patient down in Miami, and she came to me with those symptoms. She says, "I'm sitting on the court bench, I'm listening to the case, and unless I take notes, I don't remember the gist of the case. I have to take an adjournment, and I have to go and ask my assistant what was happening and get more details." And she was afraid, basically, of losing her position because if she was placed on any psychotropic medication, any kind of additional medication that may affect her thinking, she'd be taken off the big cases. So we fixed her with a proper amount of hormone replacement therapy, and within 2 weeks, she said, I definitely feel better. And within 4 weeks, she was fine. And she's still on the program now. It's about 20 years later. So when you have an issue like that, the first thing I would go to, it's so easy to do, is to have your hormones checked by a proper laboratory with the proper testing to make sure that you're testing the right hormones. Unfortunately, many primary doctors, when they have any kind of hormone issue, will check something called the FSH and the estrogen level. That is probably about 30 years old in terms of thinking that estrogen deficiency is the cause of menopause. It is not. In fact, most of our patients have more estrogen than they need, and they're deficient in progesterone, testosterone, and then the adrenal gland hormones that help us with energy and cognitive function. So we also check the adrenal gland. Very important that we go ahead and be as comprehensive as we can. Another misconception is that when they go to primary doctors mainly with complaints, and the first thing they check is, oh, well, you gained weight, or you have a mental fogginess, you're not thinking as clearly, it's your thyroid. Now, in 25 years of doing hormone replacement therapy, I have found 0 new thyroid problems. I check everyone, we monitor them, those on thyroid medicine we take care of, but I've had 0 new patients diagnosed with hypothyroidism. So to me, the focus is on the wrong hormone or the wrong set of hormones. So it's very important that you look at the sex hormones as the cause of foggy thinking and correct it. In males, the same thing. What I find is that if men need testosterone replacement therapy and they're having foggy thinking, sleep disorders, they're feeling low energy, you check their levels, You correct their testosterone, and the vast majority feel better, more energetic, they think clearer, they're able to function at a higher level. And to me, it's very similar to what happens in women with progesterone. Now, testosterone is important in women, but it's a very low dose is adequate to replace them what they need. Going back to the foggy thinking, it's very common that doctors will ask questions that kind of give the patient the feeling that, there's really something seriously wrong with me. So you have to be very careful when you go to a doctor and he starts asking about whether there's a family history of Alzheimer's, to go ahead and think twice and say, that's very fearful, it's very scary, but it has nothing to do with me. Those questions they ask, it's part of the history, but we don't ask those questions. We attack right away what the primary cause of the problem is, and that is sex hormone deficiencies and out of balance. And if you take that approach and you have what's left is almost never is there any other problems we need to address. Supplementation and nutrition are important. We do use a lot of supplementation to help a person get through the nutritional deficiencies associated, for example, with new diets that are coming out that restrict calories. Restricting calories produces a starvation state and produces what's called ketosis. Ketosis causes foggy thinking. Ketosis causes your brain not to be as sharp. So therefore, I've had a lot of patients who are on the keto diets who come in and say, I can't think as clear as I used to. What's your nutritional status? What diet you're on? Unfortunately, it's a keto diet, which is a starvation diet. People don't do well and think well when they're being starved. So it's just a thought for you to think about and understand more. You can call our office. We'll be glad to give you some advice on nutritional status for our patients and help you through with the foggy thinking and not to worry too much about the fact that you're developing senile dementia or Alzheimer's at 49 years old. Thank you.